Neurology quiz number 4. Which patients are more likely to develop serious and potentially fatal skin reactions with carbamazepine? These are patients who are positive for the HLA-B1502 allele. This is seen in higher frequency in individuals of Asian descent, and genetic testing for HLA polymorphism is indicated prior to starting treatment. Such serious skin reactions include Stevens-Johnson syndrome and toxic epidermal necrolysis, which can have a mortality as high as 30%. A warning to this effect was released by the FDA in December 2007. What is MOG antibody disease? It is a CNS demyelinating disease with antibody to oligodendrocyte glycoprotein, more common in children and young adults. Clinical manifestations include optic neuritis, which can be bilateral in up to 50%, short segment and longitudinally extensive transverse myelitis, acute disseminated encephalomyelitis, especially in children, as well as a brainstem syndrome. It can mimic seronegative neuromyelitis optica spectrum disorder. Brain MRI may show extensive optic nerve lesions, multifocal white matter hyperintensities with deep gray matter involvement. The spinal cord can show coexistent short segment and longitudinally extensive myelitis. Conus involvement is often seen. CSF shows lymphocytic pleocytosis and elevated protein, but oligoclonal bands are rare. The diagnosis is confirmed by serological testing for antibody. An acute episode is treated with IV solimedrol followed by oral steroid taper. Persisting antibody titers predict a relapsing course and may require long-term treatment with drugs like azathioprine, mycophenolate, or rituximab. Overall, the prognosis is favorable as compared to NMOSD with better recovery and less disability. What are some paraneoplastic movement disorders? Opsoclonus myoclonus in children associated with the ANA1 or anti-Hu antibody. Opsoclonus myoclonus in adults associated with the ANA2 or anti-Rai antibody. Orofacial dyskinesias associated with the NMDA antibody. Chorea associated with CRMP5 antibody. Faciobrachial dystonic seizures associated with the LGI1 antibody. The PERM or progressive encephalomyelitis with rigidity and myoclonus associated with the glycine receptor antibody, and stiff person syndrome associated with the amphiphysin antibody.